So now is the time to really demonstrate that COVID is not what is killing us. There are other things that are killing us bigger. That is the capitalism in this system that we can change now.
This is Max Rameau, strategist, theorist, author, and organizer with Pan-African Community Action, and you are listening to The Next World, a podcast about building movements. Once a month on this show, we will explore and celebrate the work of poor people's movements, particularly in the U.S. We will highlight innovative and powerful organizing campaigns and community building led by women, LGBTQ folks, Black communities, and other people of color that are pushing the boundaries and have the potential to transform this society. Today on the show, we are sharing from a recent webinar featuring organizations representing essential workers and impacted communities. The webinar opens with words from poet Cynthia Dewey Oka and features brief updates ranging from workers at the bottom of supply chains to rural communities bereft of functioning hospitals. We'll be back soon with more guests from the Frontlines and movements.
Hi, welcome everyone. Welcome and thank you all for joining us at Partners for Dignity and Rights for this series of reportbacks from organizations that are working on the front lines of this pandemic. In a very recent conversation I was having, actually with Jordan Flaherty, who helped organize this and is our Director of Communications, we were asking ourselves, what is the most important message right now? Because there are so many things to say, but the one we thought was most fundamental was that we can forget no one in this moment, certainly not those most affected. And that's not a new message, but has a very deep resonance right now. There's also been, as all of you know, a growing conversation about what is essential. We've stripped our economy more or less to what we think is essential. And what has emerged as the answer is food, healthcare, the goods we need to stay healthy, education, housing, basic income, in other words, our economic and social human rights. You put those two things together, forgetting no one because everyone deserves what's essential, and you have captured the core value of our social justice movements. But at this moment, we have seen in even starker terms that our society is not organized toward that end. We treat what and who is essential as expendable. Filling in that gap as best as possible is our community infrastructure and organizations like you're going to hear from today that have gone into overdrive to protect people. Everyone you hear from today is working 24/7 to harness our organizations and social movements in this emergency to save lives. And their efforts need your support and as much visibility as possible. So what you learn here, please share it, because you don't know when your advocacy as an ally reaches a journalist, a decision maker, a donor, a public health expert who can strengthen these efforts on the ground. We must all be partners in this moment. Finally, every single organization you hear from today also has a long-term vision. And when we win, I learned that from CIW. By the way, I forgot to say who I was. I'm Cathy Albisa, one of the co-founders of Partners for Dignity and Rights. And CIW, who you'll hear from today, taught me to always say when we win, not if we win. So when we win, we will have far greater resiliency as a society to face the next pandemic or other crises that are inevitable. And what our partners have in common is they know that the solutions are not technocratic, they are democratic. In this moment of mutual aid and solidarity, we know and feel that more deeply than ever. As COVID becomes less of a threat, we will face the aftershocks of a likely looming economic crisis. As a result, we are seeing larger calls too to make some of the emergency responses people are fighting for here more permanent, a part of how we restructure our economy, from guaranteeing healthcare to ensuring basic income to ending evictions to increasing worker power. As this emergency has demonstrated, it really is an option. We actually got a question before this event via email asking, couldn't we do all these things adopting alternative economic approaches like that person cited modern monetary theory? I'm not an economist. Although for whoever wrote that, I am impressed with what I've read about that theory, but I don't know what the theoretical answer is. I do think that part of the real world answer lies in how we respond in this and the next phase of this crisis. and that will likely determine our future. The only thing I have no doubt about is that our best possible future lies in the success of our social movements and organizations like these. You'll be hearing from a range of essential worker groups, groups working on other essential areas like education and healthcare. We will hear from a wonderful poet, and then we will have reflections from one of the most amazing supporters of our movements, Regan Pritzker of the Lieber Foundation. So thank you for joining us and for your support. And again, because we all need beauty and culture in our lives, I'm now going to turn it over to our poet, Cynthia Dewey-Oka.
Hi, everyone. Thank you so much for having me and inviting me to be a part of this. And that resonated so much with me, what you were saying, Cathy, about this moment being about not forgetting anyone. In the interest of care for time, I'm just going to read one poem. And I want to say something quickly about it is that this moment feels personal, I think, for many of us because we are feeling the impact of this crisis in our families. My parents were both healthcare workers back in Indonesia where we used to live. And my father struggled with years and years of unemployment after we migrated to Canada. And it felt like an apt moment to share this poem. For my father, who once rubbed shoe polish over his bald head. She said not to say anything because it gave you hope, which reminds me, here is the world you cannot enter. Though you brought us against the wishes of the bougainvillea, grown in clay pots arranged like soldiers between your daughters and the wrought iron gate, on the other side of which dogs, unleashed, licked themselves to sleep. I envy sometimes these days, their mud-hardened coats, shaved as I am to a worry over my shrinking Antarctic of time. No, it's not even that. The poem I should have written by now, I mean. What was sliding around inside you all those years, my painted face speaking English as though it never knew another purpose, while you knelt beside a creaseless bed, a man reduced to nothing but hours. Oh, you kept yourself busy, cooking, cleaning, washing, sewing, tying my mother's shoelaces on the steps of the bus. But purpose? That is a word for everything we have not yet found the strength to cast away. It must have been terrifying, your child, her thin wave through the fluorescent walls of a McDonald's on the first shift of her first job. You waited and waited for me to come back, for anyone to say, you are not done yet. And while you waited, other things happened. Eggs spoiled, mirrors rusted, a child thought herself a dog, and the rain clapped. I don't to this day question your version of events. When your grandson was little, my body attacked the hair on my head. It fell in fistfuls until I was half lunar. I felt close to understanding then why you did what you did. He is 16 now and refusing to cut his. All night I hear him talk with no one I can see in a world I cannot enter. He is not worrying about getting a job. He doesn't say, leave me be. Clamps headphones over the black grass, just like I once did in my greasy uniform, not recognizing you, then not holding my laughter. Pa, it wasn't that you hurt me. You did. It was that you tried and kept trying to do what you thought a father should. So that gripping the wheel with both hands, you picked me up. That night, the moon was more touchable than any country, for my first shift at my first job, like a man who hasn't been shedding himself in the dark. So that right then, looking away from you, my whole world was smooth, not a single blade survived. Thank you.
Thank you. That was beautiful and really, evocative of the struggles of working people that come to this country and those who are brought to this country and those who are from this country who are trying to, put together decent lives. Now we're going to hear from Tim Bell, the executive director of the Chicago Workers Collaborative, working with temp workers in that sector there who are working hard to produce the things we need.
Thank you, Cathy. Chicago Workers Collaborative builds power with temporary workers. In Illinois, there's about 625,000 temps who work in low-wage, light industrial, warehousing industries, overwhelmingly Latinx and African-American workers. On March 20th, Governor Pritzker issued an executive order shutting down the schools and businesses that across the state, except those that are producing essential goods. By March 23rd, CWC's workers called an emergency meeting because nothing in the factories had changed, just like Guadalupe said. Old action needed to happen because the workers know that the bosses could care less about them when there's money to be made, especially when they are temps, which are generally, there's a feeling that the workers are just throwaway workers. So they decided on a two-pronged campaign. A workplace organizing track by organizing concerted actions and walkouts, and a policy track in the form of an online petition to Governor Pritzker. The petition included banning the use of by-a-touch punch clocks so workers don't share their germs with each other when they punch in, to provide time off of work for workers who are sick, quarantined, or must stay at home with their kids or their elderly parents or other family members, and then enforceable requirements for protecting workers. Our strategy was to force the governor's office to react to the situation of companies are spreading the virus. And our motto was protect us, protect yourself, by exposing how companies were a public health threat. Our lead organizer, Janelle White, led a digital organizing campaign, which included a series of web talks on why the governor needed to act. And the talks were co-hosted by a worker and an expert and streamed over Facebook Live. Worker leaders took pictures, videos, and recorded interviews, and this fed our social media imagery and gave content to share with press. Many thousand workers were also engaged over Facebook and started complaining about the unsafe conditions. OSHA sent us an email when we requested one saying that they were not going to take any action against factories that were breeding the virus. And so we needed to convince our state's AG Labor Rights Bureau to begin to enforce health and safety protections according to the executive order. On April 1st, a photo of a line at Voyant Beauty in Countryside, Illinois appeared on the front page of the business section of the Wall Street Journal. The University of Illinois School of Public Health issued a call to action, and we hosted a web talk with the leaders of the school who echoed the message about the impending public health disaster. By April 10th, we had sent the governor's office a petition and a legal memo that was written by Brittany Scott of Partners for Dignity and Rights, explaining how the governor had the emergency authority to implement and enforce the policies in our petition. But also many bad things started to happen within our organization. Our board member, Barry Rose, was hospitalized with COVID-19 and nearly died in the ICU. Worker Assembly Leader Cecilia Jacobo and her daughter pictured here, both were infected with COVID-19. And then finally, the worst nightmare happened. One of our members, Norma Martinez, mother of two, a temp worker at Voyant Beauty in Countryside, where workers had already been agitating, died. And the workers had a protest in mourning, una protesta de luto, the next day. By this time, workers have been marching on the buses, walking out, presenting petitions. We're thankful to the attorneys at the National Legal Advocacy Network and Raise the Floor Alliance. We're helping put together the boilerplate for these petitions. And finally, a perfect storm of public health officials, thousands of complaints that went into the AG's office, and the wave of news stories convinced our governor to take action and amend the executive order to provide more enforceable protections for workers. And it's imminent that he'll announce a plan to create a fund for unemployed and undocumented immigrants to create a safety net. Finally, we began a COVID-19 worker activist relief fund to provide $500 stipends to unemployed temp workers to join what we call the COVID-19 Labor Brigade, to essentially become trained activists and volunteers in the present struggle. And we raised over $37,000 to date, which pays for 74 activists to become engaged with the goal of building a brigade of about 100 activists, a small army of leaders to build power in the years to come. Thank you.
Thank you, Tim. Thank you very much. I know that temp workers are working shoulder to shoulder under incredibly dangerous conditions. So we appreciate the hard work you're doing out there. And let's keep our eye on Chicago. We're going to hear next from Magali Licoli from Venceremos. The poultry sector is another one that's been hit hard. Probably been reading articles about the deaths and the conditions. Magali is working with people to actually change that and find solutions.
Thank you very much for inviting me to share with you what's happening at the processing plants. As you know, processing plants right now are a hotspot of COVID-19. So it's been a month ago whenever we saw an urgency to mobilize workers, to organize the community, because people were just terrified of going to work. And so we began doing an online campaign calling on all the supporters, because workers, as everybody had mentioned, the essential workers were the less protected among others. And so we began petitioning for paid sick leave, for a wage increase, for protective gear equipment. It's been a fight, and companies have started giving something, but we are talking about that a week ago, 2 weeks ago, workers on the processing lines were not granted any mask, any basic protective gear to do their jobs. And so it's been like the company fighting what we are doing, trying to convey the public that what they're doing is right and what they're doing is to protect the workers as much as they can. And so we began understanding that we really need to build workers' power, and that we really need to have the workers fighting that and speaking the truth of what was happening inside the plants. So it's been like 2 weeks ago, we began with petitions from workers and organizing with workers what they wanted and what they wanted to see in their jobs. And so they began drafting a list of what they wanted from the company. And I've been organizing workers from 2 different plants, primarily from Tyson plants. We lived in Arkansas, in Springdale, Arkansas, home headquarters of Tyson Foods, and George's, which is a smaller poultry company. So organizing workers from those plants, it was about getting the workers to speak up. So we began with this petition, and workers were gathering signatures in these different plants. With Tyson plants, we gathered almost 200 workers signed the petition, and there were more workers who wanted to sign, but they were so afraid of retaliation. We lived in a community controlled by the corporate. We have Walmart, we have Tyson, we have GBS, we have George's. So workers are just terrified to speak up. Most of the workers who work in processing plants are the most vulnerable. They are immigrants, they are refugees, and often these companies are in very rural areas, and so workers don't have any other option but to work in these plants. And actually, the immigration in Arkansas began because of the processing jobs. So many people were immigrating from Mexico, Central America, and from California too. So many of them feel like they are hopeless. They didn't have a voice here because it's very difficult to have support from the community that is controlled by these corporations. So for us, it was crucial to organize the workers and to have them to speak up and to kind of like reassuring that right now they are essential. And the government, for the first time, they have always been essential, but they declared them essential, meaning that their job was necessary for the infrastructure of the country. So we had to do a lot of job of workers' power to say we need to play our card. If we are essential, we also need essential benefits to do this job. And so we began organizing workers from these different plans last week. We delivered almost 200 petitions from workers to Tyson plant. And we saw that right after, the company started panicking and providing the protective gear equipment, and they started paying lots of money to protect their image. And so now this week they announced new bonuses and new benefits, but still we need to have full benefits for these workers, meaning full paid sick days, paid quarantine, so workers could feel safe staying at home. Right now, when the companies started to respond to that, it was already too late. Many of these plants, like for instance Tyson or George's, had announced that they already have positive cases of COVID-19, and yet they were not granted the basic protections. So we are talking about that right now. We don't know how many workers are sick, and so we are demanding this company to test all the workers, because these workers are resistant to have an outbreak, as we've seen across the country. So these workers are speaking up. These workers are desperately yelling to people and to these companies that they don't want to be in the same situation. So right now we are continue organizing workers, continue supporting these workers and gaining ILA support, because right now these people need your support. And also I think it's very important to acknowledge that this problem is just not the workers' problem. It's not the poultry's workers' problem. Is the problem of everyone, because then if we don't work together on this, we will have a health crisis, an economic crisis, and a food crisis on top of this pandemic. And we can't survive if we continue like this. We keep seeing companies putting profits over people's lives. We keep seeing the government backing up these corporations and not caring for these workers, as you said, Cathy, at the beginning, they're just expendable.
Yes, thank you. That was, as usual, powerful and passionate. And I'll just note that what you're seeing in common in a lot of these groups, worker groups that are reporting here today, is that they're all in corporate supply chains. And these companies at the top that are profiting from labor are not taking responsibility for the impact the impact on workers now, as they've never taken responsibility for the impact on workers' lives in terms of how they make their profits. So it's really something to keep an eye on, the way our supply chains work. I am going to now move to Merle Payne from the Centros de Trabajadores Unidos en la Lucha, CETUL, in Minnesota, who's going to tell us what's happening in the Twin Cities.
Hi, my name is Merle Payne. I'm the co-director of CETUL, El Centro de Trabajadores Unidos en Lucha, the Center of Workers United in Struggle. And we are a community-based organization that fights for a voice for all workers to ensure workplace and community democracy in the Twin Cities metro area. Our big picture vision of what we're fighting for is to build campaigns that take on the 0.1% that drive the Minnesotan economy, so that our members, low-wage workers, have a space at the table to decide how the entire economy functions, not just a sector, a workplace, or an industry. And through that, to be able to fight for racial, gender, and economic justice. So our members work in a lot of low-wage industries. We are actively leading a campaign right now with construction workers who build out housing in the Twin Cities metro area. And workers in non-union side of construction work face horrific working conditions. The everyday conditions that workers in the industry tell us that when you're working in construction, you expect that 1 out of every 4 jobs won't pay you. And what other job would you expect that you get 75% of your pay is just the norm? And even worse at the extreme, we're seeing cases of labor trafficking. We just brought to justice the first case of labor trafficking in the state of Minnesota in construction in January, and we're actively investigating 3 other cases. But as we're building out this campaign, at heart, what we're questioning is not just how does housing get built? What are the working conditions? We're actually digging deeper to talk about who gets to decide what's built and for the benefit of who. And we want to build a model of development that's controlled for and by the community. So what we've seen since COVID, I think like COVID has really highlighted deep inequities that have existed for a long time and really are pointing out systems that we have been naming for the many years that we've been organizing, right? And it should be shocking to us to learn that schools are saying we can't close schools because children are going to starve. Like, what an utterly violent society that we live in, that we would be that afraid that schools closing mean that children would starve, that many people would be on the verge of starving. That's horrific. It's also pointing out the deep racial disparities that exist. When you look in the Louisiana Department of Health show that while Black people make up 32% of the population in the state, they account for over 70% of the deaths. Our members in particular here in the Twin Cities, we've heard about 1/3 of the people have lost their jobs completely. About 1/3 have lost a number of hours. The overwhelming majority, somebody in their family who is making money for the family has lost income. And we're seeing many people fall through the cracks of the social safety networks that exist on the federal and state level. Anyone who is still working, we haven't talked to a single worker who is still working in restaurants or construction or any of these sectors that are getting the proper training or proper safety equipment. And what we're seeing actually, the worst of it is that COVID is leading to a point where workers are feeling less empowered to be able to fight for their rights, right? An employer says to a worker, if you don't like these working conditions, at least you got a job, right? Like, how many people right now don't have work? And in construction, where you see often a contractor controls the workers' housing, because they pay for their housing, they control their work, and they also control their transportation. They have that much level of control over your life. And if you're going to stand up and complain in the middle of a pandemic and get fired and lose your housing and lose your transportation and get kicked to the streets with no job in the middle of a pandemic, nobody's going to complain, right? So we are seeing just an exacerbation of working conditions. One thing that we've heard from our base consistently is the biggest need that they have is about rent, and the biggest fear they have is about paying rent. So what we've been doing to respond is we're both looking at immediate needs, and we're doing fundraising to be able to support our members who are falling through the cracks of the social safety networks. And in addition to that, we're hiring some new navigator positions to support our members to be able to get access to some of the benefits. We're also picking bigger fights, and we're joining a coalition of organizations to demand a moratorium on rent and a moratorium on mortgage. So we have a big action with a caravan of small farmers and small business owners, as well as workers, who are demanding a statewide moratorium on rent and mortgages, where we'll start at US Bank Stadium and go to the governor's mansion in St. Paul, and we'll be headed down the highway with the tractors of some of the small farmers who are demanding a moratorium on foreclosures of small farms. In addition, we're looking at the bigger fights and how do we not just be reactive in this moment and respond to the immediate needs, which is absolutely needed, but how are we going to fight for the long-term changes that we've always needed? And that's why this network, and I feel honored to be a part of it, has been really crucial at helping us build and stay focused on these long-term solutions through a worker-driven social responsibility model in construction. So thank you.
I mean, one of the things that's always been very clear about Satul is that you understand deeply that it's all very connected, from food to housing to work. And just thank you for sharing all that with us. And it's not just that all the issues are connected, it's that the world is very connected. So the next person we're going to hear from is Scott Nova, because this pandemic is impacting workers globally, not just here in the United States. And we are very connected to each other through a myriad of ways, including our supply chains and how we produce goods. So you'll hear now from Scott Nova, Workers' Rights Consortium, about what garment workers are going through.
Thanks, Cathy, and good afternoon to everyone. The Worker Rights Consortium is a labor rights advocacy and research organization focused on global manufacturing supply chains, in particular the garment industry, where we work with a broad network of allies across more than 50 countries, unions and other worker organizations, advocacy groups, women's organizations, fighting to address the labor rights abuses and sub-poverty wages that define the global garment industry, and helping workers seek better wages and conditions, particularly through the creation of enforceable agreements between worker representatives and the brands and retailers that have the bulk of the power in the system. For example, we were able to help create the Accord on Fire and Building Safety in Bangladesh, an enforceable agreement with more than 200 apparel brands and retailers that brought about the physical transformation of the grossly unsafe garment factories in Bangladesh, making work radically safer for more than 2.5 million garment workers. The COVID-19 crisis has been a devastating one for the 50 million workers who make apparel, textiles, and footwear across the world. It's a crisis that has both done great damage to workers and laid bare the inequities that define global manufacturing supply chains. It's a crisis that began with the necessary public health response in Europe and the US to the COVID-19 crisis, including the closure of most retail operations, which led to a sudden and massive decline in demand for apparel. The response of brands and retailers to the crisis was to do everything they could to push the economic burden down the supply chain onto their contracted suppliers and workers. And because of the inequitable structure of production and payment terms in global supply chains, they've been able to do this. In the apparel industry, the clothing that workers make for brands and retailers is not paid for by the brands and retailers until months after the clothing is delivered. The suppliers must shell out all of the upfront cost of production. The workers must do all of the work. The goods must be shipped. And then months later, the brands pay for the goods. So at any given point in time, there are tens of billions of dollars worth of apparel orders in process around the world, where workers have completed or done much of the work to complete the clothing, but brands and retailers have yet to pay a penny for the clothes. And so brands and retailers are able to take advantage of this reality by simply refusing to pay for tens of billions of dollars worth of clothing that workers had already produced. The response of suppliers, the manufacturers of the clothing, to the brands and retailers' actions, unsurprisingly, was to fire large numbers of workers without compensation. Indeed, in a survey we did of fact owners in Bangladesh, 75% of them admitted that they had engaged in large-scale dismissals of workers and had not paid to workers the compensation legally required of them. The only way to protect garment workers in this circumstance is to compel brands and retailers to pay their bills, because their failure to do so, in addition to resulting in mass firings, was also giving those suppliers that still had orders to produce a powerful incentive to complete those orders by any available means. So on the one hand, you had mass firings without payment of compensation. On the other hand, you had workers pressured to come to work to finish any orders for which the brands were still willing to pay, subjecting them to serious health risks. I'm happy to say that working with a large range of organizations and with unions around the world, we have begun to see significant success in pressuring brands and retailers to actually pay for the clothing workers have already made. A significant list of key brands and retailers have committed to pay for orders, and that has significantly relieved the burden on suppliers and workers, although many key players still refuse to pay, from Walmart to Gap to many fashion brands. And so we're working to continue to pressure brands and retailers simply to pay their bills so that workers' wages can be paid. We're working to support the efforts of unions in the industry to ensure that factories stay closed until such a time as they can be operated safely. We're also working to press for the mobilization of public resources through international financial institutions to provide ongoing income support to garment workers throughout this crisis. A tiny fraction of the trillions of dollars being mobilized for bailouts and stimulus in the US would be enough to pay every garment worker globally for the next several months. And yet, of course, governments in the wealthier countries have given no consideration to the plight of the workers in global supply chains as they've developed their own rescue plans, even though those workers are very much part of large corporations based in the US, based in Europe, that are going to benefit from those rescue plans. So we hope to be able to work with others to mobilize public support through international financial institutions to help ensure that workers can survive through the crisis. And finally, we see both a need and an opportunity here to challenge the underlying inequities that have made the crisis so difficult for workers. The lack of living wages, leaving workers without savings, the inequities in buyer-supplier relations. So we see an opportunity and will work toward deeper reform as the crisis abates.
Thank you, Scott. Thank you. It's really important not to forget that when we say we're all interconnected in this pandemic, we are actually all interconnected always. And supply chains globally, supply chains domestically, they actually all present a lot of the same problems. So I'm going to turn it over to Marita Canedo from Migrant Justice, who we've been working with for the last number of years.
Hello, everybody. Thank you, Cathy. My name is Marita Canedo. I'm part of Migrant Justice. Migrant Justice is a grassroots organization in Vermont that organizes dairy immigrant farm workers. So in the past 10 years, migrant farm workers in Vermont have been organizing around human rights. A little bit of the context of the farms here. The dairy farms are small. An average of workers is 4 to 5. The smallest one have 1 worker. The biggest one have 15. And what happens is that the farm provides housing. So people live where they work and they work where they live. And this means that situations of having a worker viable 24/7 during a day reaches to abuses, also poor housing conditions. In Vermont, we have a winter of 6 months, so there are houses that don't have a heating system, no clean water. So farm workers have been organizing around this, and we learned about the WSR model from the CIW. And we adapted the model to the dairy industry. We created the Milk with Dignity program. And the Milk with Dignity program started with the first contract with Ben & Jerry's. And now the program is in the 3rd year of rolling out and functioning very well. It's 20% of the dairy in Vermont under the program. And with this, we knew that this program is really working and the standards can be enforceable and workers are receiving really good protections of not being fired or laid off. They have sick days, paid sick days, better housing situations. And so we knew that this model needs to expand and we needed more contracts. So we launched a campaign asking Hannaford supermarkets to join the program. And with this, more farms and farm workers will be under the program and protected. The campaign had to stop because of COVID. We were on a tour and then we were preparing a big action in Maine where the Hannaford headquarters are right now. And we had to start responding to the immediate needs that we already knew that were happening. So talking about housing, we know that if somebody gets sick in a farm, it will be very difficult for that person to get in isolation when people are sharing a trailer with 5 other co-workers. Also access to gear, protective gear, access to healthcare, it's an issue here. So some things that we've been doing is partnering with other organizations, service providers, to be sure that the community have access to protective gear and tests, and also to the hospital. We are working on the legislative way, to have at the state level, to have benefits for workers. So the stimulus packages that the state is going to bring have to include undocumented immigrants and farm workers in the dairy farms. And other ways, we've been creating different funds to just provide for the workers that need it. So what we're seeing mostly in Vermont is not people getting sick in the farms, because the farms are already isolated and people are actually living in more solitude and out of access to food. So what we've seen in the long term is that farms are going to be closing because the prices of milk have decreased so much, and the co-ops that are buying the milk are only going to pay 85% of the production. So we're seeing a reduction in the economy that's going to affect directly to the workers. And so when you lose your job, you lose your housing situation as well. So on this, we are partnering with other organizations to try to have relief if people get sick or have to lose their jobs or their housing because of COVID-19. But in the long term, we're going to see that a lot of people are going to lose their jobs because farms are going to be sold. So on that, we need to expand this program, because under the program, like I said, people are going to be protected with basic days and not layoff, and also the economic incentive for farms that are going to be able to keep functioning.
Thank you, Marita.
Thank you.
And I think a lot of the presentations have reflected how poorly organized our industries and economy is. The fact that neither the industries nor our local governments were prepared to provide basic health and safety is just a reflection of pre-existing crises, right, that are intensified. And we are grateful for all the community organizations that are stepping into that blank space that needs to be filled, but also pushing for longer term changes so that this is not our permanent situation. I'm going to now move us over to Baltimore to hear from Todd Cherkis, co-founder of United Workers.
Hi, and thank you for inviting us. It's been a really great discussion, and I think you said it right, Cathy. There's this blank space, and we've been talking in Baltimore about how this crisis, there was a crisis before COVID happened that we were pushing up against, that our city and our state and the country, as we all can tell, was unable to meet our basic fundamental needs for housing, education, work with dignity, healthcare, and so forth. And now with COVID-19, we're seeing how all of us, no matter where we are in life, in some ways related to this crisis. And if we don't address these universal needs together, then we are all at risk of getting infected by COVID-19 and continuing to experience this kind of awful situation across the country. United Workers was founded in 2002 to really address basic fundamental human rights around work with dignity, living wages. We did a big living wages campaign and a number of campaigns that were successful, organizing day laborers and service sector workers. We won a statewide sick leave bill, and we're seeing the importance of sick leave right now, and the gaps in that fabric across the country. We've also organized around housing issues and won pretty recently we created Affordable Housing Trust Fund, and a fund that is committed, the city committed to $20 million a year into that fund with this economic collapse. Some of that's for sure in doubt, but there is a fund there, and we're actually negotiating right now with the city on how to adjust it so that we can address this issue around renters and needing immediate assistance right now to deal with this, being unemployed and being out of work for so long. And we've also been dealing with the environmental justice issues. We took on the trash burning and incinerator crisis. And our city already has an incinerator. It's the worst polluter in the country. But it had planned to build the biggest incinerator in the country, and we stopped that from happening. But we're wrestling with an incinerator that was built in 1985 and is our worst air polluter. As we're seeing the studies come out around COVID-19, there's a direct link between communities of color and environmental justice issues, particularly around air pollution and pre-existing respiratory illnesses, and the preponderance of COVID-19 deaths and severe cases. And so it's really put that issue up there in terms of these intersectional ways that this issue is relating to people. But soon, right after the crisis happened, we had a virtual Zoom meeting. We have a once a month coalition meeting. We turned it into a Zoom meeting, and it just was clear that people really wanted to be together in any way, shape, or form and connect. And through that conversation, we formed committees to address the urgent needs around housing and homelessness, as well as mutual aid in just knowing your rights, basic information about unemployment insurance, landlord, tenant, and food access. We've been pushing with the city through our emergency COVID response team to house all the homeless and move, we call it empty the shelters, move folks from congregate living spaces and into the empty hotels that are downtown and vacant right now. We've been able to move 300 homeless into hotels with after significant and ongoing public pressure. City Council passed a resolution endorsing our demands, calling on the mayor to use emergency funds to do that. There's actually more than enough money at this point for the city to move all the homeless into hotels. There's still stumbling blocks. I think the biggest one is still this issue of just who is our city for, and the poor and homeless just haven't counted for very much in the city's budgets in the past, and how the city has even thought about who it's protecting. So they've waited for people to get infected, and now there's at least 50 that have been infected in city homeless shelters, and have had to act to move and clear out some of the shelters that have infected homeless folks in them. And as some of our members have said, this is really a death sentence for some folks because the city is not acting quick enough. So we're continuing to put public pressure on the mayor and the state to do this much quicker than they are. Our mutual aid teams have really picked up, particularly around this issue of food. We're getting I'm sorry. I'm going to have to ask you to do the last point and let Nidhi jump in. Yeah, I'll just real quick finish. We are at this point looking at different levers at the state and city level to really push forward on the housing issue as well as the other issues that I mentioned. But I just wanted to end with, we did a workshop where we wrote a collective poem together, and one of the participants said that, this crisis, politicians are asking for when are we going to get back to normal? And to him, normal was what caused the crisis. And I think that's a really key point. Thank you. No, thank you. And again, over and over again, we see how these things are all terribly connected. We're going to move now to Nijmi at Put People First, Pennsylvania, and let's hear what's happening there.
Awesome. First of all, I just want to say thank you so much to Partners for Dignity and Rights for having me tonight, and I'm really honored to be here. And I want to say thank you very much to all of the co-panelists and all of the people attending tonight. I know that oftentimes we don't get enough thanks for the work we do, so I just want to say thank you so much for everything that you do. My name is Nijmi Zakia Zarinko, native Pennsylvanian. I live in Philadelphia, and I'm a co-founder and volunteer with Put People First PA, and also the Pennsylvania Poor People's Campaign, a national call for moral revival. Put People First PA was started in 2012. We were founded as a grassroots base-building human rights organization formed in Pennsylvania to unite the working class across geography, across race, and many other lines of division. I grew up in Western Pennsylvania in a small town, but I've lived in Philadelphia over 25 years, and those experiences helped shape me to understand that we have a lot more in common than we have different, but the powers that be really want to keep us separated and divided and conquered. We're a healthcare organization, but healthcare is not a single issue for us. It's a lens and a way of uniting the working class. Our fight is with healthcare profiteers, but it's also with the state that facilitates the profiteering of insurance companies and other healthcare entities at our expense, leading to our sickness and our death. We've won fights against the state. Particularly, we won the first ever public hearing from the Pennsylvania Insurance Department in 2016. And in 2017, we won statewide town halls to increase transparency, accountability, and participation for people across the state in the rate review process for healthcare premiums. And Partners for Dignity and Rights has been a partner of ours from the very beginning. I want to talk a little bit about what things were like in Pennsylvania before the pandemic. As you'll hear, directly after this, I'm going to be part of a mass meeting with the Poor People's Campaign, a national call for moral revival. And I'm going to be asking the question of what happens when a pandemic hits on top of a catastrophe. In Pennsylvania, even before the pandemic, we experienced the closure of 8 hospitals since the beginning of 2019. Before the coronavirus, 40% of children in Pennsylvania were poor or near poor. Before this crisis, there were over 11,000 cases pending in PA immigration courts. Well before the beginning of March, the minimum wage was and still is at $7.25 an hour. Before COVID-19, up to 60,000 people were evicted in PA every year. We had higher levels of lead exposure in many counties than Flint, Michigan. We had $1 billion of our money given to fossil fuel, fracking, and chemical companies in the form of tax subsidies. So this is a situation in Pennsylvania before the pandemic. So I want to talk about what we're doing in response, and I want to link 5 demands to 5 realities. So as I just mentioned, there have been 8 hospitals closed in Pennsylvania since the beginning of 2019. So one of our demands is very simply to reopen the closed hospitals. Another reality, and this is something actually that Partners for Dignity and Rights has been, sort of looking up and providing research and policy support, and found that 1.5 million people in Pennsylvania stand to lose their employer-based health coverage. So very simply, we are demanding that the governor of Pennsylvania, Governor Tom Wolf, apply for a waiver to immediately expand Medicaid to every resident in Pennsylvania. Another reality we know in Pennsylvania is there's a chronic shortage of personal protective equipment for healthcare workers and other frontline workers, many of whom are in our base. And so we are demanding that the governor immediately direct production of personal protective equipment for healthcare workers and other frontline workers. Another reality is that we know that you can be an asymptomatic carrier of the virus. So we are demanding universal testing. Currently, testing is happening in outdoor facilities, the same places that they're trying to treat us, instead of reopening hospitals. We also know that since the beginning of the pandemic, the private healthcare industry has shed 43,000 workers in the middle of a pandemic to maintain profitability, once again putting profit over people's lives. So our demand for our governor is to bring private healthcare facilities under public control for the duration of the pandemic and beyond. We've been mobilizing these demands through our nonviolent Medicaid Army and our 9 chapters throughout the state and members in 17 counties. Our nonviolent Medicaid Army is our base, modeled after the nonviolent Army of the Poor that Dr. King talked about in the original Poor People's Campaign.
Ishmi?
Yep.
I'm sorry, we're just at time. This is so painful. You have no idea how difficult it is to stop any of you.
Well, I'll just end, Cathy, I'll just end by saying you can find out more about our work at putpeoplefirstpa.org. Thank you so much.
I'm almost glad we only have one more person, not because I wouldn't want to hear a lot more of this, but because it's really hard to stop any of you. It's extraordinary what everyone's doing. And that was really powerful, Nijmi, as you always are. Thank you. We are now going to move over to talk about what's happening in education with Letha Muhammad, who is with Education Justice Alliance and is part of our Dignity in Schools campaign. Thank you, Letha.
Thank you, Cathy. Good evening, everyone. Thank you to my co-presenters. I really appreciated hearing about the important work that you all's organizations are doing. And I'm here representing Dignity in Schools campaign. We're a national coalition of over 100 organizations stretched across 27 states. We're working to dismantle the school to prison pipeline and to transform our public schools into a system that values the humanity and dignity of all of our students. We also work to support students and communities, as well as parents, as decision makers in shaping public policy to ensure our public education systems serve us all well. We're led in these fights by young people, by parents, by teachers, again, across the country in 27 states. And we're fighting to dismantle systems of oppression in our public education system. In particular, looking at the ways in which racism and criminalization occur in schools and cause Black and Brown students in particular to be pushed out. We have families across the country who are struggling through this period of remote learning that don't have access to technology, computers, or internet services. We also know that the crisis in our healthcare is also impacting those same families. Our members of DSC have had to pivot and adjust, right? The work that we're doing in our own communities to just help families care for the basic needs, is providing food and mutual aid to our communities, providing support for parents to help them around remote learning within their homes. So, you know, this crisis is just further showing us the inequities that exist within our public school system. And so we're committed at the Dignity Schools campaign to continue to fight to dismantle oppressive systems within our public school systems. We're fighting for the dignity and humanity of all students, and we're pushing for healing and restorative justice practices to be placed in our classrooms as we go back into schools. Thank you.
I don't envy the next person because she has to give us reflections on all this. And this was a lot, but I want to introduce Regan Pritzker, who is the trustee at the Libra Foundation. I know it's a sort of standard thing to say, oh, our foundation partners, they're really partners, they're really with us. It's true, a lot of the times, sometimes it's more complicated. I have to say, in the case of Libra Foundation, the rhetoric is absolutely reality. One of the best, most authentic, most genuine supporters of social justice and grassroots work across the country. And we are all deeply grateful for the wonderful role that you play, and really looking forward to your impressions. So let's hand it over to Regan.
Thank you so much, Cathy. And just a huge, deep appreciation to Cathy and to Cynthia and to Lupe and Tim and Magali and Merle and Marita and Todd and Nijmi and Talitha for really moving and inspiring me. And it's true, it is really hard to go last, except what I'm feeling good about is I don't have to say much because you all did an incredible job of summarizing your work. And it's great to know that there are places people can go for more information. I'm really inspired. I'm feeling a little emotional after hearing all of these stories. And my reflection is really just that I'm reminded that essential workers are always essential. It's really been highlighted in the media, you know, people standing on their balconies and clapping, and I'm super excited about that. But just to underline that this is a journey that has been going on for a long time. Folks have been working and organizing around these issues for a long time. And so seeing those threads and that continuity and how we can move from response to really activism and organizing to make these changes more sustainable and permanent is something I'm really inspired to hear from all of our presenters. So thank you for that. And then the other piece is just that these are not isolated struggles. Several of the speakers mentioned this, and I really appreciated the framing of reminding us that all of this organizing sits inside a broader vision and framework of racial, gender, and economic justice and human rights. And, you know, what we can do, what can we do? A lot of the folks on the phone are asking, how do we get involved? What can I do? I think the call to action is really clear in terms of moving resources to support the Frontlines, those that can best identify systemic solutions And we can help make those changes and solutions more permanent by engaging. So we can do that in different ways. As a funder, it's easy to go first to funding. So moving not just small grants, but large, chunky long-term support to frontline organizations and the infrastructure networks that support them. But you can also fundraise. So funding, fundraising, promoting these organizations and their campaigns within your own networks, as Cathy mentioned at the top of the call, and connect, reach out. Folks are posting their websites and their campaigns. So whether it's in your region or through a thematic that you care about, reach out to those folks to build relationships. I think that's a really important way of making this work move forward. Just a huge thank you to Partners for Dignity and Rights for hosting this conversation. It's the beginning of a series of conversations in celebration of their 15th anniversary, and a specific offering if folks are interested in giving to this work. There's a Giving Tuesday event that's being planned for May 5th. And you can support Partners for Dignity and Rights or these important partner organizations through that mode. If you're so inspired and if you're able. That's all I have to say. I just want to thank everyone. I'm so grateful for the work you are doing every day.
Thank you. And thank you again, everyone, thank you, Regan, really. And thank you for everyone for hanging in there. The kind of questions that we've gotten is how to support your campaigns. How does this work at this moment where there's this scarcity conversation overlapping with needs for solidarity? Specifically, there was a question for Immokalee of, is there some tension between getting PPE to farm workers and healthcare workers, for example? There was some, Nijmi mentioned the support for healthcare workers in her state, but there was also another question of how does any of this work connect to healthcare workers? And finally, Scott, there was a question for you on, have we moved those international financial institutions? Not the simplest thing.
A question about the invocation of the terms of the Accord to challenge what the brands are doing, and that is going on of the debates within the Accord Steering Committee, where various articles of the Accord have been cited as obligating the brands to behave in a manner differently from how they're currently behaving, and that's been one of the tools that's been utilized to successfully press certain brands to change their practice on payment for orders. So that's been encouraging. I remember that the second question was, on the IFIs. Those discussions are ongoing. We're cautiously optimistic that there will be some funds mobilized from IFIs, although obviously there's competition for dollars and an enormous need globally, but we're cautiously optimistic about movement for supply chain workers specifically, though it's too early to tell for certain. And then, of course, if there are funds mobilized, it will be vital to ensure they actually get to workers. And we focused in particular on defining eligibility broadly to include all workers who were making money to make apparel when the crisis started, even if they are informal workers, even if they are contract workers.
Thank you all. Thank you, Scott. And for those who don't know much about the Accord, I would definitely look into it. It's been one of the most significant global achievements around reigning in corporate power and getting workers some basic protections. It's true. And it's an honor to work with you on it. So do others have specific suggestions for those listening in terms of how they can support, or any reflections on the scarcity conversation that makes it seem like there is a trade-off when in fact, when one looks deeper, there shouldn't be?
Sure, I can jump in really quickly to respond on the part of CIW. So in terms of how to help and support these efforts, we were incredibly impressed with many of the presenters who similarly had built really clear, websites and places where people could go to get information about how to support. I know that we did. I posted in the chat box the link to where anybody can go to follow the CIW's ongoing efforts to procure greater healthcare resources for Immokalee. Again, we just got the first big step with that, with getting testing, but that doesn't mean, work is done. And so we're going to be continuing to do that, and we'll keep that page consistently updated with ongoing ways for people to support. So I can respond on that. And, for everyone to keep an eye out. And then in terms of scarcity, I think that one of the things that that we've realized is that there is, and a lot of people have talked about the gaps and the idea of stepping into those gaps as these community-based organizations. In Immokalee, when it comes, masks is a good example of that. I think we specifically didn't seek out N95 masks, kind of respecting that there was a call on the part of many healthcare workers to preserve those masks for people who are in COVID-specific healthcare zones, but nevertheless really pushed for high-quality masks that could prevent illness and ensured, we worked with a lot of public health advisors to ensure that we were getting the right kinds of materials. And there was even a group of farm worker women who, got tired of waiting and said, if we can get the materials, we're going to get the right design, and sewed hundreds and hundreds of masks to be handed out in Immokalee. So I think on one hand, there is this concept of scarcity, and that is real in a lot of ways, but I think that there are ways to work around that to still ensure that everyone has what they need, especially when we have communities who often are facing that scarcity, stepping up to figure out ways to take care of themselves, and I think that that's really what we've seen in Immokalee, both on the organizing front and then also in just some of those really basic ways, whether it's, CIW creating posters and education materials in the correct language and format for our community, or farm worker women sewing masks for themselves. Obviously, in an ideal world, that's not the position that anyone would be in, but I think that thinking creatively and not underestimating our community's ability to take care of itself is also important in times like this.
Yeah, I just want to increase the need of masks and gloves. As the ones that in the dairy industry, masks and gloves are used for everyday work. And these things are now not finding anywhere. So they are different than the masks that people are using just to take care of the COVID. And also looking at the long term, what we are seeing, like I said before, we are seeing farms that are going to be closing, people losing their jobs and losing their housing because the corporations are deciding these prices of the milk going down, and we're dumping milk where in other places people are needing of food. So I think we need to look at the long term, that there are programs, there are models that bring these companies to really be responsible and change the economy. The essential workers are called essential but are forgotten and disposable. And we know that they have been essential all this time. So now is the time to really demonstrate that COVID is not what is killing us. There are other things that are killing us bigger. That is the capitalism in this system that we can change now.
Thank you to all our speakers, to Regan, to Cynthia, who couldn't stay. And I hope we can do this again.
Okay, that's our show. Thank you for listening to The Next World. I'm Max Rameau. You can find out more about my work at pacapower.org. That's PACA power.org. You can read more in depth on the many issues and organizations featured today on the Partners for Dignity and Rights website, dignityandrights.org. We'll be back with another episode of The Next World next month. Until then, please subscribe and tell your friends and post reviews wherever you get your podcasts. Until then, organize, organize, organize.